The vaccine must be distributed to everyone, everywhere. We cannot rest or truly recover until there is fair distribution to every corner of the world. When any suffer, we all suffer. And tonight, we stand in solidarity with the millions of families across India who are battling a devastating second wave.
Prince Harry at the Global Vax concert last night addressing the devastating COVID wave that is crippling India. More than 400,000 new cases on Friday, setting another grim record as the country hurdles towards 1 million deaths by August. Our foreign correspondent Maggie Rulli is on the scene in New Delhi with the latest. Good morning, Maggie.
Hey, George, good morning. Yeah, you said it. Those numbers, they are just staggering. More than 4,000 cases on back-to-back days. But pretty much every expert agrees that those numbers are just a fraction of reality. Most likely, they are 5 to 10 times higher than that. And with those numbers constantly rising, people here all tell us the same thing. They're scared, George, and they also feel helpless. Nearly everyone has a loved one who needs help right now. And for so many people, they just cannot find it. Many people say the healthcare system here has failed them, and they're now turning to outsiders, volunteers, regular people that are stepping in to help. We visited this temple that's now turned into a makeshift clinic. It is run 24/7, day and night by volunteers. They say they've helped about 15,000 people get oxygen in just the past few weeks. And while we were there, we met one young woman whose mother was sick. She told us that late last night she started struggling to breathe. She had low oxygen levels. She rushed her to the hospital, and she was turned away. The hospital said they just had no oxygen to give her. Now, thankfully, she was able to make it to that clinic. Her mom was doing better today, but for so many, it has been too late. The crematoriums here in this city, we're told, are just running at an unprecedented rate night and day. We were at one of them today in New Delhi, and we met a man who was there. His mother had just passed away only hours after he had finally found her a hospital bed, and he told us he has lost all faith in the healthcare system. He blames the government, healthcare, and George, he also said something that sticks with me. He said, you know, he is a successful engineer. He's always been able to pay for health care, and this is the first time that he has truly felt helpless.
The healthcare system basically collapsing over there. What's the greatest need right now?
Now, well, George, the immediate urgent need is oxygen, basic medical supplies. We spoke to a doctor just a few moments ago inside this hospital, and he told us they need ICU beds, they need more staff. But long-term, what India really needs are vaccines. You know, it's hard to ignore the fact that India is the largest producer of vaccines, yet inside the country, there is a severe shortage. Only about 2% of the people here have been fully vaccinated, and the vast majority of experts agree that if India wants to get itself out of this crisis, it has to vaccinate its population. George.
Maggie Rulli on the scene in New Delhi. Let's bring in the president's chief medical advisor, Dr. Anthony Fauci. Dr. Fauci, thanks for joining us again this morning. You just heard Maggie Rulli right there. I know that President Biden has pledged to send vaccines to India. He's authorized transport of PPE and oxygen. What more can be done right now?
Well, right now, there have to be several things. One, from within the country, and I've been speaking with some of them right now, actually, over the last couple of days. You know, they've really got to get hospital beds and do really what the Chinese did way back a year or so ago, where you essentially build up with the equivalent of field hospitals. You've got to get that. You can't have people out in the street not having a hospital bed. The oxygen situation is something that was really critical. I mean, to have people not have oxygen is really tragic, what's going on over there. But the end game of this all, George, is going to be to get people vaccinated. As you said on the piece just a moment ago, that India is the largest vaccine producing country in the world. They've got to get their resources not only from within, but also from without. And that's the reason why other countries need to chip in to be able to get either supplies for the Indians to make their own vaccines or to get vaccines donated. One of the ways to do that is to have the big companies that have the capability of making vaccines to really scale up in a great way to get literally hundreds of millions of doses to be able to get to them. So there's an immediate problem, which is hospital beds, oxygen, PPE, and other supplies. And then there's the problem looking forward of how you're going to shut this down, how are you going to turn it around, how are you going to break the chain of transmission. Vaccines is one of them, but there are other ways too, like shutting down the government. I have advised them in the past that you really need to do that. You've got to shut down. I believe several of the Indian states have already done that, but you need to break the chain of transmission. And one of the ways to do that is to shut down.
As you know, the long-term solution is vaccines, but it's not just India. Africa's vaccinated only 1% of its population compared to more than 40% here. And the head of the World Health Organization is calling the inequitable distribution of vaccine a moral outrage. You've said that companies should be scaling up, but many of those companies say that President Biden's plan to have these patent waivers is going to prevent them from scaling up. It's going to hamper the supply chain and actually set back the vaccine production effort.
Yeah, I don't think that's the case, George. They can scale up. You know, they've done an extraordinary amount. You've got to give them credit. They've really done something that is really quite impressive in the way they've gotten their vaccine supply up and out for the rest of the world. They can scale up more. I think the waiving of the patents and the TRIPS is not going to necessarily interfere with that right now.
Meantime, here at home, the vaccine demand is dropping pretty sharply. States are turning down doses across the country. We seem to be bumping up against the limits of Americans willing and eager to get the vaccine. How do we convince the holdouts?
Well, you know, it is a smaller group, George. You're absolutely correct. That seem to be recalcitrant. So there are two major ways, I believe, that we can address that problem. One is to get trusted messengers, people who they trust, to get to them to convince them why it's important. Those messages could be anything from sports figures to entertainment figures to clergy or even to their family doctor to explain and convince them why it's important for their own health, for that of their family, and for the community in general. But the other way is what we're doing, is to make it extremely easy for people to get vaccinated. I mean, typical example is that now we have 40,000 pharmacies where you can actually just walk in, no computer, no online, no appointment, just walk in and get vaccinated, as well as mobile units that are going out. So those are the two major ways I believe we can just get into that group that really seems to be recalcitrant to getting vaccinated.
A third possible way may be making the benefits of the vaccine very, very tangible to people. You've had experts like the former head of the FDA, Scott Gottlieb, say it's time to start relaxing the indoor mask mandates. Is he right?
No, I think so. And I think you're going to probably seeing that as we go along and as more people get vaccinated. The CDC will be almost in real time, George, updating their recommendations and their guidelines. But yes, we do need to start being more liberal as we get more people vaccinated. As you get more people vaccinated, the number of cases per day will absolutely go down. We're averaging about 43,000 a day. We've got to get it much, much lower than that. When that gets lower, the risk of any infection, indoor or outdoor, diminishes dramatically.
Finally, as you know, it's Mother's Day, and there are lots of questions out there about the safety of the vaccines for pregnant women and women trying to have kids. What's your message to them?
Well, if you look at the data, George, there doesn't seem to be a problem at all. There have literally been tens and tens of thousands of women who are pregnant who've gotten vaccinated. There are no red flags, nothing that looks like there's going to be any problem. So I think that that's something that we really don't need to worry about that much. It looks good.
Give everyone a sense of what the country is going to look like next Mother's Day.
Well, George, I hope that next Mother's Day we're going to see a dramatic difference than what we're seeing right now. I believe that we will be about as close to back to normal as we can. And there's some conditions to that, George. We've got to make sure that we get the overwhelming proportion of the population vaccinated. When that happens, the virus doesn't really have any place to go. There aren't a lot of vulnerable people around. And where there are not a lot of vulnerable people around, you're not going to see a surge. You're not going to see the kinds of numbers we see now. That being the case, I think we could approach what we used to remember as normal before all of this tragedy happened.
Dr. Fauci, thanks as always for your time and your information.
Thanks, George. Thank you for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.